A lot of people focus on individual health, and we forget about how much the environment actually impacts residents' health and well-being. So things like whether or not there are safe places to walk, safe sidewalks, access to grocery stores close by with good quality food, the whole range of things influence whether or not people can be healthy in their communities.
It's important for community members to take the lead because it's their neighborhood. Too many times folks come in and don't ask the community what they want and instead put in what they believe they want. And then there's friction and there's collisions of mindsets. We have to learn how to be engaged correctly by speaking with and not to the community.
The Diabetes Impact Project, Indianapolis Neighborhoods, is an 8-year initiative that is funded by Eli Lilly and Company, and was started because a number of stakeholders in the community were identifying lots of escalating rates of diabetes and said, we need to do something about it.
I've lived in the near Northwest consistently for the last 14 years, but then off and on since I was a baby. I was actually born here. The near Northwest has been suffering for decades of disinvestment, of neglect, of really just no one really caring as much as they do for other areas.
The near Northwest is one of our communities that has been involved with DIPN the whole time. And they are a great case study because what has started as some small things has really grown and expanded and shows really what a community can do when they come together to really invest in things that contribute to the overall health of the community.
The Diabetes Impact Project, partnering with folks like Aspire House, has been crucial because they're already in the neighborhood and they know the layout of the land, so they are on the ground listening, and then we all work together to be more synergistic.
The Aspire House is a community service organization. We serve the Northwest Landing neighborhood and then the greater Indianapolis neighborhood in health, wellness, fitness. 2 years ago, we started Sunday suppers as a way to get our community more connected and a way to present healthy food in a great way. So it's free and open to anyone from anywhere, any walk of life. The DIPN piece really helped take it to that next level with the education. There's a lot of resources out there to help people learn how to live a healthier life. But what we found with DIPN is that we were able to connect with them, spread the word more, and get more of our everyday residents just involved and looking at it.
The physical activity that we've created and funded between jump roping and hip hop step aerobics, even the personal training, people that we hire are folks that can actually relate to the needs and the hurdles that we all face just trying to get out to go work out, and the reasons why we don't work out, and also the reasons that we would keep working out.
Inferno Step is a hip hop step aerobics class. We meet at Flanner House Mondays, Wednesdays, and Saturdays. DIPN, Diabetes Impact Project, has shaped Inferno Step with Chris in multiple ways. For one, making it accessible to everyone. For two, we provide resources such as nutritional facts and how to shop, when to shop, and how to meal prep. If the Diabetes Impact Program did not provide these resources or these classes, I think there would be a major lack of education and a lack of resources. I feel like my clients in particular would not know where to turn to for those resources and for that help.
Steering committees are actually the driving force of making an impact for the Diabetes Impact Project. The steering committee are who select the ideas, think outside of the box, find ways to make the goals and the desires for the community a reality.
Being on the steering committee, our programs through the neighborhood have impacted a change whereby now our sidewalks have been prepared and made more handicapped accessible, especially for our seniors who are in wheelchairs and walkers. There are now walking groups. They walk from their senior homes to the park. They walk from their senior homes to the bodega to shop and see what fresh vegetables are there from our Flanner farms. We have affected a lot of our seniors' lives, but now we want to focus more on our youth, particularly the 1 to 5 years old. If we teach them now what the impact of their eating will do in their adult lives, we can help them get to a healthier lifestyle.
The environment of any community The way it looks, the way it's been taken care of, also the way it's been neglected, will definitely have an impact on the health outcomes of the people who live in it. I hope that we can fully be able to start generational lifestyle changes, not just coming and trying to solve a problem today, because it's not going to happen today.
These health disparities that exist in these communities have taken decades, generations to put into place. We can't expect to be done with that in an 8-year period. So we have to be building for these projects and things to be sustainable and go beyond.